Presenting Pediatric Health Exchange. This platform app allows medical service providers and patients have access to lifelong electronic patient health records used for care coordination and chronic disease management. Lack of patient data is the biggest problem facing providers, patients, or their guardians in Kenya. Providers and parents need to have a consolidated patient information on demand on a vendor-neutral platform. The Health Exchange gives patients access to their records at all times. Complete information on a patient, which strengthens health decisions and outcomes. Pediatric Health Exchange links disparate healthcare information systems together and allows patients, physicians, hospitals, public health agencies, and other authorized users across the nation share clinical information real-time under stringent security, privacy, and other protections. The Health Exchange looks to improve the health of the well-being of children in Kenya through an integrated pediatric network connecting hospitals, physicians, clinicians, and healthcare providers. The platform will track and help physicians address issues including poor nutrition, frequent illness, weight management, high blood pressure, and hypoglycemia, body fat percentage, and caloric needs for a growing child. This preventative and curative approach to tackling acute childhood malnutrition and a general lack of medical health records for most is greatly needed in Kenya. At a minimum, the PHN will capture data on vaccines, routine healthcare visits, family dynamics, nutrition, pediatric conditions faced by the child, with comparisons against pediatric norms and growth charts specific to Kenya. Using big data, providers will be able to improve patient outcomes, manage chronic illness, and improve overall population health. Through this integrated network, providers can help identify and adopt clinical protocols for treating disease states impacting children, leveraging tools to monitor and record protocols, share best practices, and improve individual patient and pediatric health management in Kenya. The goal is to provide seamless healthcare services from the perspective of the patient and family across the entire care continuum, from enjoining as many providers irrespective of institutional, departmental, or private, public, or community-based organizational boundaries. Parents will also have access to their child's medical history on demand, free of charge, shareable to participating pediatricians or specialists. This is an example view of our patient record portal. This is an example of our integrated electronic health system and proprietary POS. We also have an electronic prescription platform connecting doctors to pharmacies. Our goal to market is by identifying medical service providers, customize the platform apps for their needs, and integrate suppliers and financial institutions. The platform is free to ecosystem partners. Our market teams then engage experiential marketing companies to activate service providers and end patients and drive consumers to these merchants. Pediatric Health Exchange is free to ecosystem partners. We make our revenue on wholesale markups on products sold to physicians, medical services providers, and pharmacies, typically about 1.5% gross. Two other revenue lines include revenue share from financial institutions based on financing receivables on the platform, and market information and intelligence developed on the platform as service is rendered. For our initial healthcare vertical, we are currently in pilot mode. We will scale market development in 2019 and expect to gross 11,500,000 in revenue by year 3.